Hello everybody, welcome. My name is Matt Beck. I'm a licensed marriage and family therapist and I'm the clinical director at 12 South Recovery in Orange County. And today we're going to talk about the connection between mental health and substance abuse. And we did get some questions. The first question that we got today was, how are mental and behavioral disorders treated? Well, what mental health and behavioral disorders are treated, we take an individual approach, right? We want to make sure that the approach is individualized, that we understand, is the mental health more dominant or is the substance abuse more dominant? And how are they linked? And how could they be treated together? Oftentimes there's a very high correlation between substance abuse and mental health. Close to 70 or 80% of our substance abuse clients also struggle with some type of mental health concern. The next question we received was, what does a behavioral intervention plan look like? And behavioral intervention plan is a structured approach. It's an individualized approach. The mental health professional wants to get to know your story, your history, and then formulate a plan, a treatment plan, and some goals around your unique story, your unique abilities, and the unique goals that you have. The next question we received is, what is medical treatment for mental health? And in any treatment facility, a psychiatrist or a medical director will always take the lead with a nursing staff to make sure that all the medical concerns are addressed, that they're taken care of, that certain conditions are being assessed properly, that the right medications are being provided, and that any kind of co-occurring physical concerns are being treated by a referred specialist. The next question is, should family be involved in addiction treatment? Well, absolutely, family should be involved if they can. And I'm hopeful, and we're hopeful always, that all of our clients have lots of family support and social support coming in. Because most of our patients, if not all of our patients, are going to need a lifetime of support. So that family support, to have that army, those people around them when they leave, is so vital to a person's continued recovery, and to involve them in the early stages is paramount. The next question is, what triggers mental health issues? Oh, well, that's a loaded question because there are so many triggers for mental health issues. Different types of anxiety or stressors, grief or loss, relationships, the ups and the downs, right? Just daily occurrences. All types of things can be triggers for mental health. If you develop mental health concerns because of these triggers, it doesn't mean there's anything wrong with you. It just means that your mind and your body is reacting to these stressors and you need to seek out support. And your body is just telling you you need support. The next question that we received is, what causes poor mental health? Poor mental health can be caused by a variety of things, right? I can't express enough the need for self-care, all around self-care, physical, mental, spiritual, to check off every day what you did for yourself physically, what you did for your mental health, your spiritual health. How did you connect with your peace? How did you connect with your source for enlightenment? This is what causes mental health concerns, is when you don't have that connection. And so the goal of therapy, the goal of treatment, is to reconnect with that source, to teach you how to reconnect. So the next question that we have is regarding treatment planning and assessment, and it's, what is one of the first steps in the treatment planning process? Well, one of the first steps is to get to know you, right? The therapist, the professional, wants to get to know you, because how can we develop a plan for you if we don't know you, right? So the important thing is to develop rapport and trust with your provider so that you feel comfortable sharing about you, all the things that you want to share that maybe you haven't been able to share before for the first time. The next question here is, what is a treatment plan for behavioral issues? A treatment plan for behavioral issues, right? We design what we call a SMART goal for those things, right? A measurable, attainable goal, something where you can track your progress, right? We want to set dates, we want to set timelines, but we want these goals to be measurable, attainable, right? Rather than look at the big picture, which can be overwhelming at times. Look at what's right in front of you and take care of that. And that's how we develop goals. We develop them one step at a time, just like your recovery. 12 South Recovery in Orange County is committed to providing exceptional service for those struggling with addiction and mental health. If you or a family member is struggling, please reach out to us now.